Oh, well, let's start. Okay, so hello everyone, thanks for attending. This is the Discharge Planning and Ethics and Legal Issues session. Because the poll was really close, it was 51% and 49%, I decided to just combine it into one session because technically speaking, they're both really high yield, especially with the new format of the exam. So the first part will be discharge planning. I think we can have a short break because it's quite lengthy. I have about 20 slides, and then we can go through the legal and ethical issues. I have a few.
Sorry.
Mute.
Sorry.
Okay, am I unmuted?
Yes.
Okay, fantastic. So I have created a few, what I think is scenarios that will really make you think. And the scenarios are not necessarily what you will get in the exam. They're just designed to make you think about what the stations are about and what they're trying to test and what they're trying to glean from you. Okay. So about discharge planning, does anyone have any sort of idea what discharge planning is?
Mainly discharge destination, if there is any need of package of care, if there is any need of ongoing community physio or OT, if the person can be alone, if they need to live downstairs, if they need to go to a hospice, to a rehab bed, to an assessment bed.
Yeah, fantastic. That's exactly what it is. I think you have a lot of experience anyway in this field. So as a foundation doctor, you will be vital in discharge planning because you will know your patient the best. In fact, apart from the nurses, you probably spend the most time with your patients. So know your patient really well, get down every detail of their history. You will be spending lots and lots of time with them anyway, sorting out little problems that they might have and answering dozens of questions. One of the principles of the discharge planning station is getting a thorough social history. That includes employment, accommodation, where do they live, what type of house is it, do they have any family, do they have any outside support, can they complete the activities of daily living, how do they move from the bed to the chair and so on and so forth, how are they doing when they go upstairs, can they manage stairs okay, and any type of extended support structure, which includes already in place support structures that are available to them. In the exam, even though discharge planning is extremely vast and you might need to do discharge planning sometimes in children, but obviously there's no pediatrics in this exam. It's usually an elderly patient with long-term chronic problems or many chronic problems that needs the MDT input, so multidisciplinary team input. I've sent a bunch of suitable questions that you can ask for the station already in the Telegram group. This is the list of typical chronic issues that you might be faced with: COPD, heart failure. They can have all of them, or they can have one or two. I think probably in the exam, they will not be that cruel to give you COPD, heart failure, diabetes, CAD, but in real life, you would definitely get patients with everything on this list. Kind of typically, it's always a patient with COPD, and then you'll have to ask about breathlessness, how they get upstairs, and assess if they need long-term oxygen. Who makes up the MDT? So does anyone know what an OT is?
Occupational therapist.
Yeah, do you know what they do?
They check how well someone can mobilize in their home environment.
Yeah, so they do things like home visits. I've had patients who are living in absolute squalor. So patients who are hoarders and patients who, because they couldn't walk up the stairs any longer, they had just started sleeping on the floor or sleeping on their couches. So they go and actually do home visits and assess for things like that. What about PT? What's the role of PT?
Rehabilitation.
Yes, they walk around with the patients, assess their transfer status, so how well they can transfer from different sorts of positions, from lying down to sitting up to standing up and back to all those positions. I'm sure you all know what nurses are and care support workers. Does anyone know what a disco is?
Yeah, it's like a nightclub.
A discharge coordinator or a discharge facilitator.
Yes.
I think that's wrong.
It took me the longest time to realize what this is. And I think unless you work in the NHS, you will not know what this is. Yeah, this DISCO stands for Discharge Coordinator. They're a special type of admin / social worker that sits like kind of like a spider in the middle of the web and coordinates everything. So they take input from the medical team, from the PTs, from the OTs, from the nurses, and they communicate with nursing homes and social workers and try and kind of put everything together so that the patient can be discharged as quickly as possible. Because, you know, if patients, especially elderly patients, if they stay in hospital for too long, they can get hospital-acquired pneumonia. Yeah, so social workers, nursing homes, SALT. Anyone heard of SALT?
Sorry, what does DISCO stand for again, the actual acronym?
It's Discharge Coordinator.
SALT is speech and language therapist.
Yeah, speech and language therapist. So these are the dietitians. They assess how well a patient is swallowing. They might give recommendations for other types of feeding, so NG feed or NJ feeds or percutaneous feeds. Yeah, and then there's other types: learning disability, mental health, palliative care, if needed. I think these are terms and terminology that will come up more on the SJT. So, discharge planning. Oh, does anyone have any questions so far?
Yeah, I had a question about the social worker.
Yeah.
So when, I guess, would you get that assessment from a social worker? Like, what do they do?
So it's typically an MDT. So what happens is you go in the morning, and you know what a ward round is, right?
Yeah.
Do you know what a board round is?
Sorry, what?
A board round, BOARD.
Oh, no.
So that's where every single member of the MDT that I've just mentioned stands around a list. It's usually names on a whiteboard. And we go through the list of patients, and there will be a social worker there, or now virtually, if you're lucky. And there'll be OT, there'll be PT, the discharge coordinator should technically be there, and everyone provides their specific input. So you don't really have to do anything in this particular station other than mention social support.
Sorry, just a note on that. So mainly social, you would think of somebody who has housing issues or who is like, and you would say, well, they need a social referral because it's not really clear where they're going.
Yeah, so you'd only be able to gain that after taking history. Okay?
Nothing on the chat yet.
Okay. So how do you tackle the station? It's a communication station, and of all the stations, I thought it's fairly straightforward because it's just a conversation with you and someone else. So you just talk to someone. So you do your intro, you establish understanding just like any other station. Okay, and you try and ease into it. You say, Mr. Jones, my name is so-and-so. Is it okay for me to have a little chat with you today? We've seen you on the ward round this morning. We've had a look at your blood results and everything's looking really good. How are you feeling? They'll say, I'm feeling much better, doctor. So we're thinking of discharging you soon. How do you feel about that? They might say, I'm all right, but I have a few questions. I'm not too sure about that. I'm a bit concerned about some things. And then you go on and say, is it okay for me to ask you a few questions for me to help plan your discharge safely? And that's how you enter that bit. Okay, and that's how you ease into the station. And then you ask your social history, the list of questions I sent in your chat, you wrap it up with your ice, and then you turn to the examiner and see if they have any questions if they want to ask you. Straightforward?
Yep, no questions here.
Yeah. I'll send this PPT in the group as well. So here we come to a scenario. I can't really see the end of this because, oh, there we go, just move that on. Does anyone want to read it out aloud? It's not a scenario that you can do a role play with. It's just to read and make you think about how you want to tackle the situation. But if you want to do it as a role play, if anyone wants to do it, they're more than welcome.
I can read it.
Okay.
Yeah, scenario. Keith Jones is an 86-year-old male who was admitted for the 6th time this year for an acute exacerbation of COPD. The consultant has told him during this morning's ward round that he's medically fit for discharge. Keith seemed concerned and has asked to speak to a doctor. Speak to the patient.
Does anyone want to try it? You don't have to if you don't want to. So it's a scenario for you to go back and think about. Yeah, this is typically how it will be structured, and this is the type of patient that you'll probably get.
Can I try it with you?
Yeah, sure.
Hello, my name is Galzika. I'm one of the junior doctors at this ward today. Can I confirm your name and date of birth?
It's Keith Jones, and my date of birth is the 18th of March, 1944.
Okay. How would you like me to call you?
Mr. Jones is fine.
Nice to meet you, Mr. Jones. I can see that your one of the consultants mentioned that you will be discharged today. Can you just tell me a bit more about what brought you in here and how you're feeling about that?
Oh, doctor, you know, I've always been so breathless, and this time it was just too much. And my neighbor called the ambulance, and that's how I ended up in hospital again this year.
It must be quite scary for you. Just how are you feeling at the moment? Do you feel ready to go home?
Well, doctor, you know, I'd like to go home, but I'm a bit afraid of going home because I don't want this to happen again to me, and you know, I don't really think that I can cope at home.
I totally understand from where you're coming from. Can you just tell me a bit more about who you live with at home, and so that I can actually help you a bit with that?
Yeah, so I live alone at home. My wife died 4 years ago, and she used to do most of the things at home. Obviously, I used to help her as well. And, you know, with this breathlessness, with the COPD that the doctors tell me, I can't really do the things I used to anymore.
And this must be quite scary for you. So yes, I can see the consultant has mentioned that you are ready to go back home. But what I'm here for today is actually just to ask you a couple more questions about more about your situation at home, and so that we can just provide you the best support possible. You mentioned you live at home, and I'm sorry to hear about your wife as well. So who is helping you with doing all the daily activities at the moment?
Well, I have a son, but you know, he's got his own family, and he comes once a week and helps me with the shopping, and that's about it.
All right. And how about can you walk around at home, or do you find it difficult?
I get really, really breathless, doctor. I mean, I can't even go up the stairs anymore.
Okay. Did anyone tell you about that there are people who can help you with coming back to your place and assess your home situation?
Oh, I didn't know anything about that, doctor.
So there are things that I can do for you. So there are occupational therapists who actually can do a home visit if it's okay for you, to check what they can do, so that, for example, they can find ways so that you avoid going up the stairs, and maybe they can make sure that they can give you all the necessary things on the same floor, if that would be helpful for you. Shall I arrange that for you?
Oh, yes, I think I really, really appreciate that, doctor. Thank you.
All right, Keith, anything else in particular you're worried about that I can help you with?
I don't think I'm very steady on my feet.
Okay, and why do you think that?
I have a lot of difficulty getting
Aja
up.
block कर के बुलाने का
Aja?
स्कैमर क्या बोला
हाँ,
पता है उससे डाल दो ना आप लोगों
हाँ,
तो वो डाल दिखाते हो बाहर
हाँ,
मेरे मुंह पे एक्साइटमेंट देखिए कितना मजा आता है
हाँ।
मैं सत्ता मान ले मैं बड़ा मजा आता है मुंह में
Can
I can't find it.
वो उसने स्क्रब अप नहीं
you
किया
doing with that?
यार सजीर हमारे
Done.
I'm sorry. Okay, just keep going. So, you mentioned that you're unsteady. So, do you have any? Were you given a wheelchair, or how? Can you tell me a bit more about that?
No, doctor, I don't have any type of special equipment. It takes me maybe 15-20 minutes to get up.
Okay. Well, I'm really sorry to hear that. That must be quite a lot to go through. So there are a couple of other people I can speak to as well. Have you heard about? Have you been seeing the physiotherapist so far?
Oh, I think a nice lady has come around the ward and has been helping me walk around.
All right, that's good. I'm glad. How's that been for you so far? Have you been managing all right?
Yeah, I think it's really been working. Do you think I can get one of those frames?
Definitely, Keith. What we will do is I'll speak to the PT and the physiotherapist as well, and we will also arrange a frame for you. And just to see, because you live alone, you mentioned about your neighbors. Do you have anyone else who, as a next of kin, that can help you with things like going shopping and stuff? Or
Doctor, I have a son, but he lives quite far away. He comes and visits me every week and helps me with shopping.
all right, that's good to hear. Thank you for that information. All right, and what about something about your breathing? How's that been so far for you now? Do you feel all right with?
It's been okay in hospital because I'm on oxygen, but I don't know how I'll manage when I go home because I don't have oxygen at home.
Yeah, so that's another thing that we can organize as well. There's this machine called BPAP. So I will speak to my senior and we'll clarify this for you and see whether we can arrange something so you can actually use that at home as well. So it'll be easier for you so you don't need to come in. Well, thank you so much, Keith. I will be speaking to some of the social workers as well, which can maybe give me a bit more advice on how we can help you further. If at any point you have any questions, please feel free to speak to me or speak to one of my colleagues. And I'm sure, I just want to let you know that you are in safe hands, and we want to make sure that you'll be safe to go home as well. That's the most priority. Okay?
Thank you very much, doctor.
Thank you so much. Sorry. Thank you.
Well done. Okay, that was really, really, really well done. You missed out quite a bit of the questions, but that's absolutely okay. So as we've already seen from the feedback, the examiners are quite lenient, and I honestly think that that's a pass. Just be wary of saying definitely that we're definitely going to do something,
Okay.
because it's not your decision at all whether the patient gets a frame or not.
Yeah, that was my point as well.
Yeah.
And if you said that the occupational therapist will do a home visit, they will look at you with the bad eye. They will assess and make a decision.
So don't ever say definitely or we will do this. Say I will ask the OT or will ask the PT. The aim of that is just to show the examiner, number one, you know who the members of the MDT are, and number two, you're not trying to make decisions yourself. Okay, but that was really, really fantastically well done. There were some questions about going upstairs and cooking, activities of daily living. How do you bath? How do you go to the toilet? Who cooks for you? Downstairs or upstairs? Do you have any financial problems? But it's absolutely fine. You know, in the exam situation, when you're there with the patient actor, and if it's actually an 86-year-old man, you will remember these things. But just go through the list of questions and make sure you ask like 80% of them.
Yeah,
really.
correct. Because I've also need to think about carer as well, isn't it, in this case? So I think I can just elaborate on that. So I was thinking about that. Yeah, I just got a bit blown
Just say
after that.
there are carers that we can offer you, but I will ask the discharge coordinator. I will ask one of the nurses if you can be considered for that. So you can get carers once, twice, up to 4 times a day. They'll come in, they'll cook for you, clean for you, make the bed, help you to the toilet, things like that. So yeah, just explain the role of a carer and what they do.
Thank you so much for your feedback.
Yeah. So
Diana, you have a question?
oh yeah, sorry, any questions?
Hi, yeah, I think that was really good. So, yeah, anyway, I was just wondering, do we have to mention anything about medication? I know the task doesn't say anything,
Yeah.
but do we have to just say, like, has anyone talked to you about the medications that you have to take home, or nothing like that?
So no, not necessarily, because discharge planning, even though medications and a discharge summary is important for it, it's because this particular scenario said that he's medically fit for discharge. But that reminds me of something about the oxygen therapy. So you would say that you would, so there's something called oxygen at home treatment team, or
Long-term oxygen therapy.
yeah, long-term oxygen. So you can say we can consider you for long-term oxygen. BTS guidelines currently state that outcomes in COPD are very good if patients have at least 15 hours of long-term oxygen per day. Could be anything from 0.5 liter up to 4 liters, so nasal specs. So you could say that, but always say we can consider you for that. As for normal medications like antibiotic prophylaxis or steroids, I wouldn't mention that.
Would you then say maybe like we'll try to refer you to a respiratory team so they can assess if you need a long-term oxygen therapy or something like that?
No, I would say I'd refer you to the appropriate team to assess if we can send you home with long-term oxygen.
Would you think of, because he's been admitted 6th time, and that's quite in the prompt there, would you say something like pulmonary rehabilitation clinic, or?
Not pulmonary rehabilitation, but the PTs can do that. So if he's suffering from a lot of secretions, or if he mentions it, I've been coughing a lot of sputum, or
yeah, but that's something the PTs will do in hospital. If it's outside, then you might need to refer him. I don't know.
I don't know. I always just
all right, never mind.
PTs.
Yes,
I
too
always
far
just
away.
said PTs.
Yeah,
PTs will sort that out.
Yeah, okay.
I've never had to do referrals to clinics. PTs usually do that.
So I have a quick question about the station itself. So when it comes to discharge planning, do we just refer to, you know, so need to do a little bit of counseling? For instance, like in this case, we have to ask about the social history regarding smoking. So talking about that as well, or like, you know, vaccination, like flu vaccination, do we have to do a bit of counseling, or it's just simple discharge referred to the MDT, well, members of the MDT?
Right, so if you do mention long-term oxygen therapy, I don't think you will be faulted if you don't mention it, but if you do, you should ask, do you smoke? Because smoking is a contraindication. They cannot be sent home with an oxygen cylinder if they're smoking. And as for the other things like vaccinations, I wouldn't really ask it. It's more about discharge planning, the person as a whole, social issues, home issues.
Okay, perfect. Thank you.
Okay.
No further questions.
Okay. So one more scenario. Anyone want to read it?
I can read it and someone else can do the...
Can I do it? Can I do it?
So Claire Davids is a 72-year-old female who was admitted with delirium secondary to constipation. Her constipation has resolved with phosphate anemas, and the current discharge plan is to send her home with regular laxatives. The consultant reviews the paramedic's notes on the ward round about the condition of her home. He asks you to speak to the patient to find out more. Speak to the patient.
Okay. Can I start?
Yeah, whenever you're ready.
Okay. So, hello, I'm Dr. Ijaz. I'm one of the junior doctors working on the ward today. Can I confirm your full name and date of birth, please?
Yes, my name is Claire Davies. I was born on the 13th of September, 1948.
Okay. What would you like me to call you?
Claire is fine.
Okay. So how are you doing today, Claire?
Oh, I feel much better, doctor. I feel much lighter.
That's really good to know. And so the consultant did the ward round today, and he thinks that you're well enough to go home.
Mm.
However, I just want to come and ask you a few questions about your home. Is that okay, Claire?
That's fine, doctor, but my home is absolutely fine.
So how do you feel about going home?
Oh, I want to go home. I like to be home. I'm missing my cats.
Okay. So do you live alone, Claire?
Yes, doctor, I live alone.
Okay. And how are you coping at home alone?
I think I cope just fine, doctor.
Okay. So are you able to do everything at home by yourself?
I think I manage just fine. Yeah.
Do you think you'd need any help with anything at all?
Well, my home is a bit messy, but that's about it.
Okay. And is there any particular reason why you think it's messy?
Oh, you know, my back is not as it used to be. I can't really bend down anymore to clean.
Okay. So would you like some help with that?
Well, if you want to give me help for cleaning, I won't say no to that.
So are you able to do your other things like cooking and getting your groceries, going to the, because you mentioned like you've got problem with your back, so like, you know, doing your daily activities?
Well, my neighbor, actually my neighbor's daughter, she gets me microwave meals from the co-op, and I haven't really eaten or cooked anything in years. I haven't really eaten a cooked meal in years.
I see. Well, Claire, we will, you do understand that if you don't make changes in your diet, this could cause you to become very ill again like you were.
Hmm.
And we don't want that to happen, and we don't want you to go through that pain. So it's important that you eat a healthy, balanced diet.
Okay, doctor.
You include lots of fruits and vegetables, and you try and cook yourself.
Mm-hmm.
Do you think you'll be able to do that?
I don't think I'll be able to cook for myself, doctor, and who will go out and get groceries for me?
Okay, so in terms of all these things, do you think if we do a home visit and we send the occupational therapist to your house just to have a look and see if it's safe enough for you to go, and then we can arrange a care plan for you and see if some carers can come and help you, how would you feel about that?
That's all right, doctor. I think that's okay.
Okay, so I'll speak to the consultant again, and we'll see if we can do this before going home. Do you think that would be okay?
Yes, that's fine.
Okay. So thank you, Claire. I'll see what we can do, and then I'll get back to you.
Okay. Well done. That was very, very good as well. You missed out a lot of the history. I was trying to like direct you to ask me about my actual home. Is it a single story? Is it double story? Do I live downstairs or upstairs? I would have said that I'm not able to go up the stairs anymore, so I just kind of live and sleep in a bundle of clothing on the floor, on the ground floor. All these patients in these scenarios are patients that have actually been my patients. Obviously, the names and everything have changed, but these are actual patients and actual scenarios. I think it was really, really good. Just remember your questions and just ask more detailed questions. So you were good in that you elaborated on things, but you kind of went down on that path and you forgot to go back up and ask the rest of the questions. So just keep the questions in the back of your mind. You didn't ask me about dressing up in the morning. You didn't ask me about bathing, going to the toilet. You did ask about grocery shopping and eating. And it was excellent that you picked up on my meal habits. So eating microwave meals every day would probably cause me to be constipated. But overall, really, really well done.
Sorry, so I just wanted to ask a question. So in these questions, there's no need to go into the medical history, right? Because that's dealt with. We just primarily focus on a detailed social history.
Detailed social history.
So who do you live with? Where do you live? And the floors in the house, are you able to, and then even
I wouldn't say the floors of the house, just tell me about how you live. Tell me where you live, tell me how you live. And then these are patient actors. They're very, very good at directing you in the station.
So same approach, leave it open-ended, and then where we feel ask specific questions.
Yeah, ask specific questions and go down that path until you've gotten every possible bit of information from that path. But don't forget the list of your regular questions that you should have in the back of your mind and work down.
Okay. Yeah. Thank you very much for your feedback.
Yeah. Just like any other station.
I have a question, please.
Yep.
Okay. The list of the social question, do you have it on this presentation, or is?
I've sent the list in the Telegram group.
In the Telegram group. Okay. Yeah. Then my other question is these, I was told that if the question doesn't have date of birth, if the question just have the years, you should only ask, how old are you? Can you confirm your age for me, please? And not, can you confirm your date of birth for me, please? Because otherwise you'll be throwing off the patient, the actor, because they don't, if they are given that they are 72 years, and then you ask them date of birth, it might be very, very confusing for them to start calculating. So that's what I'm told. I'm not sure if that's correct or not.
I'm not sure who told you that, but always ask the date of birth. Okay, it's a unique patient identifier along with the name, and the patient actors will have a pre-prepared script. They will know who they are pretending to be. So they'll have it written down. Sometimes you'll even notice them looking down and reading their script. So I would say always ask the date of birth.
Okay, thank you.
Yep.
So when it comes to the diet, again, I know she mentioned that she has her neighbor helping her. We should also probably mention that we're going to refer them to a dietitian so that they can give them advice specifically, on what foods are good and what to avoid. Now, obviously, she said she can't do any of this stuff on her own. So would it be worth asking her then, if she's able to use a computer, or if she has a computer at home, because there are some online services where you can have your groceries delivered to your home if, her neighbor obviously isn't able to get a specific list of groceries for her that she might need?
You can absolutely do that, but I think you might be thinking too deeply about the station.
Okay.
Yeah, I would really just keep it simple, because it's simple. It's a simple station.
So when it comes
by all means, if you want to ask in that way, you can. There's nothing wrong with it at all.
Right.
But I would just keep it simple.
Okay, so then when it does come to her groceries, like, let's say you say, all right, we'll refer you to a dietitian. They'll tell you what's good for you, what's not good for you. And if she says, well, I don't know if my neighbor, would be able to get me a specific list of groceries, what can we offer them in terms of helping them get those groceries? that, you know, their neighbor might not be able to get for them.
The carers would do that.
The carers will? Okay. All right.
There's a care plan in place. The carers do that.
Sorry, I'm going to disagree with that. Carers don't do shopping and don't do cleaning.
Oh,
The
did
the
it not?
NHS provide. No.
Okay. Well, I usually just leave it up to the discharge team.
Yeah, definitely. We'll just say that I'll get the discharge facilitator to come and have a chat with you, see if there's any other needs or something.
Yeah, so any other way that we can help you with that particular issue, just say we'll get the discharge team to do that.
Yeah.
We just refer them and then say they'll take care of it.
Yeah.
Okay.
I feel like if she's unable to get her own groceries, then she might have to be reassessed to go to like a residential home or something like that.
No, you wouldn't send somebody for a residential home just because of groceries.
72-year-old, otherwise independent lady.
Can you say the charities can get involved?
Yeah, that's what I was thinking. I think Age UK offers.
There's a lot of services around, like even for cleaning like unkept properties. There's Revival that can clean the property. There's a lot of things that can help people. That as Shar said, is more like the DF or the disco to do. I think we're going too further into the station.
Sorry, going back to also you mentioned, you know, she said she lives on the second floor, can't get around too easily. Now, if you know, you wanted to ask her if she'd consider maybe moving somewhere where she'd live on a first floor, so it would be easier. Who would take care of helping her kind of arrange that as well, if it's something she's open to?
So that would be the OT. So you say, I will ask the occupational therapist to come and have a chat with you as well to see if we can do anything about that.
Okay.
And that's it. That's all you say. Don't say anything else.
Okay. Thank you.
Don't go down the rabbit hole of things you're not entirely sure. See, I wasn't entirely sure. So Malin just told me that carers don't do shopping. I wasn't aware of that. But I would not say that we will ask your carers to do shopping for you. I'll say, if I wasn't sure about anything, I'll say, I'll ask the discharge team and get back to you. I'll ask the discharge coordinator and get back to you. And that's perfectly acceptable.
So really what we would definitely need to know for a station like this is knowing who to refer them to for which specific thing in their lives needs addressing. So what occupational therapy would take care of, what the discharge planning team would help them take care of, and things like that.
Yeah, so I would know I would do the social history very, very thoroughly. I would focus on that mostly. If you don't know each member of the MDT, that's not such a train smash, okay? But just know how to do your social history really, really well. So that's number one. And number two is proper communication. That's what they're assessing in the station. I've given you everything, what the OT is, what the PT is, what a disco is. So if you want to name drop that in the exam to get your brownie points, do that.
Well, I'm not thinking necessarily even in terms of name dropping, but because this is a discharge planning station, I was just thinking, you know, maybe they would be looking for whether or not we know who to refer them to for what specific aspect of the, you know, home conditions or changes need to be addressed.
Yeah, but think that, for instance, Sharon, she's an F2 already, and she wasn't clear about the carers. So I think, as I said before, I think we're thinking too far ahead into the station. So yeah, have a vague idea of what the MDT is and what they're on about, but don't think too much about it, because it's something that you will learn on the job, and you will be told off many times by the other members of the MDT. That's my take.
Yeah. At the bare minimum, if you know what an OT is, if you know what a PT is, and if you mention discharge team, you will be fine.
Somebody asked if we should have mentioned physio review because the patient couldn't bend down.
Yeah, you can say, I'll ask the physiotherapist to come and have a chat with you.
No further questions.
Okay?
Okay.
That's the last scenario for discharge planning. Shall we have a break and then come back and do ethical and legal issues? I think this is going to be a lot. There's going to be lots of questions and lots of debates. So I think we'll need a break. We'll get a coffee or a tea or something.
We've got to know. For me, it's a yes. I don't mind.